Hello, this is Dr. Justina Agnieszka Chevalier. As I mentioned, the purpose of those videos is reduce of abuse of prescription medication, especially psychotropic ones, due to ignorance of causality in human as a functional unit, one individual, in society surrounded by other humans and goods. That is due to the fact that medical education is isolated from field work and is in conditions that are sterile, presenting humans as if it was in a vacuum, isolated person observed, and nothing happens in no feedback from the outside environment. We breathe because there's air. We have the changes consistent with sexual act because there is preferred and preferring by own changes to become compatible in pleasure to have a child, ideal sexual partner. In absence of such partner, there is need to non-request such from others by education first. What is the difference between disease and between natural physiologic state? Pleasure versus distress or pain as indicator of death. If we can solve by education, patient education, the problem and enable wanted by two family to happen and provision based on the natural fidelity based or loyalty to basic instinct based union of two to provide for the two, then we do so. In case of persons such as myself who have high degree of specialty, like I have a medical degree and other postgraduate specific training and a lot of research, that is when persons such as I, in times of demand, when there are many persons or animals, depending on field or plants, in field of depends on field of specialty, in suffering towards death, we are impeded from pursuit of sexual union and family, and that is normal. When do we not administer drugs? When that happens, and a person has drive to work and has to do so because others are busy doing something else, we enable it because once that is over, that person will assume for own enjoyment wanted sexual also and other relationships apart from work, and that is true for all. We do not force those because of meat industry and poultry or growing basically animals like dogs or cats, because that causes distress and is cause of also suicide and a need for drugs to endure unwanted or wanted-less sexual relationships and enforce fidelity. This is majority of marriages in so-called reputable environments that are per function obliged to stay together, also by education to fulfill a role for others, and that is not optimal for happiness, and that happiness then manifests itself when that relationship is dissolved and persons can perform as single units, a human, or when those persons are matched with preferred based on their own instinct and that other persons, couples, and that is to the happiness. The separation causes gratefulness and resolves many diseases. Many couples like that, such as Gordon Thompson and his new wife, and many other couples who were prior to that married, having still immature what in drug world is called mind expansion, which is the realization of pleasure. What in pleasure sexuality in love provides, and pleasure derived from love and adoration in context of love as well as in context of deity and social functions. That is a topic that I know very well and I can also cover here. However, this is topic strictly related to drugs. Persons use drugs, recreational drugs, to mimic states evoked in love. And there's no functional pleasure scale in medicine. It is a mistake. I created such and numbered from -5 to 5 in function of pursuit in space and time to proximity of having offspring like scale to rate enjoyment versus frank pain from sex and love. And that is to apply in consultories a person each alone as if it was a teenager in pediatrics as source, number one source of such information, combined with impressions of the provider that cannot collide with what that person says or conveys. Now, to understand that, we need to first address what happens, like I mentioned in that video, during sexual surrender. Muscle relaxation, inability to concentrate, mind that forgets or stops being oriented in time and space, as well as an impression of being unable to move or perform activities, slowing down pleasurable ones, speech that is impeded altogether or slurry or lower in intensity, and attention only to source of that person, and occurs in function of reciprocity, meaning realization that the display of manhood for a woman or display of womanhood for a man is to cause love and is intentional. So in proportion to reciprocity, intentionality is when that state occurs. That is often pathologized to sustain based on commitment that is rational, or to enable work that is non-essential for immediate survival, and drugs are administered instead to mimic those states as recreation at will, in dysfunction from male-female interaction, or cause it with someone else who is not the source of that, called then and pathologized as sexual dysfunction. We can reduce use of sildenafil and all those antidepressants and anxiolytics and fear of performance when an individual is source of arousal, and always, because that's how the sexual act is constructed, vice versa, so always the other person as well. Mind and expansion is used often and abused in mass media and in medicine to describe states from physiological changes occurring in function of pleasure caused in reciprocity, or in function of being loved and loving. An example of that, for example, is hypersensitivity in pleasure. Hypersensitivity in pleasure versus painful one in to reject stimuli present in autism is confusion to the person's source of such changes. It means that if there is reciprocity in prepubertal, pubertal or postpubertal person of sexual relationship in love, that person has strong preference for specific individual and mother, father, siblings, friends and strangers touching, cause an impression of being overwhelmed pain or an impulse to reject, to push away being touched. While that person that is loved, that gave hope for sexual union based family and children, is wanted to touch, and that scale, that differentiation leads to understanding in medical providers of and parents and those persons as well each of what is happening in body, and then we introduce the theories of physiologic changes in particles, circuits, and neurodegeneration that is always also in function of suppression of spontaneously occurring wanted physiological, also sexual, principally sexual also, changes with drugs, suppressants such as anti-seizure medications, to discard love, called stabilization, is unethical when that person does not suffer because there is even slightest chance of reciprocity. And usually there's need to medicate both persons and pathologize both persons, and that sickness consists of being in love and being impeded to benefit education or work pursuit or family life otherwise, or so-called more appropriate partner based on proximity of education, and push away the partner, stigmatized one, that is preferred in sex to have children with and form attachment because of that bonding pleasure in orgasms, lifelong, and have love for these children conceived in such way. We can change that by educating and by patient awareness, as well as adjustments in legal actions later on to stop demonizing all of sex and having only protection against unwanted, meaning with wrong person sex, or sex in situations when there is a death threat, actual one, impossibility to replace the worker, and someone pursues that activity which is unwanted, and it is very rare and not also sick, but a reason to educate and explain that the source, that other person, it is not willing or able to have sex or relationship because that person has too many lives on own hands, and therefore is not source of changes in the other person but love and sex then are separated, and persons are coupled up in such way that those ascensions to have children occur in synchronous way, and in times where there is no longer immediate risk of destruction and death.